Hi and welcome. My name is Dr. John Raymond Baker. My practice is Baker Chiropractic of Longview. We're located at 1420, that's 1420 McCann Road in Longview, Texas, in the Brookwood Shopping Village. Our office number for appointments, consultations, etc. is 903-753-5400. That's 903-753-5400. Our email address is bakerchiropractic@gmail.com. I wanted to talk to you a little bit about car wrecks and how they can affect you. A lot of times people will have a car wreck, they'll go to the emergency room, and emergency room doctors usually look for fractures and cancer. They don't see fractures or cancer, they usually say you're good to go and there's nothing wrong. That couldn't be farther from the truth. Car wrecks, especially those that involve whiplash or hyperacceleration, hyperdeceleration, flexion extension, can cause you to lose the basic curve in your neck that's important to maintain the integrity of the movement of your neck and to keep from having too much wear and tear. Now, let me demonstrate a little bit about what can happen. Normally you have kind of a flattened out C-shaped curve in your neck. It's held there by muscles and ligaments that attach back here, and it allows it to flex forward and redirect the forces of gravity, your weight of your head and gravity, to the front, like that. Now what can happen is you're going along with your neck in a nice curve, you get hit, it straightens up, the muscles go into spasm, and then it's just pounding like that on your neck. And it can hasten wear and tear and lead to eventual osteoarthritic changes of the neck. If you want to think in practical terms about the way this can happen, you can take duct tape, tape it around your fingers so that they can't move, and you go around just pounding it into something hard, and you get a similar effect, and you can actually feel it in the joints that it hurts. It's causing wear and tear at that level. The same thing can happen in your low back. You have a similar C-shaped curve in the low back. You get hit, it straightens up, and then the pressure goes straight to the bottom. This can cause a decrease in the open space for the nerve that exits from the spinal cord. It's called decreasing the patency of the intervertebral foramen. And what people often hear is a pinched nerve. Actually what happens is you get increased pressure on the nerve, and that can cause changes in the way the nerve reacts, and it can cause pain. That's just one of the changes that can happen as far as a car wreck, is the change in the configuration, the alignment of the different segments of your spine. Another thing that can happen, and often does happen, is you get soft tissue damage. Now soft tissue, what's soft tissue? Well, soft tissue is not hard tissue. If you think about bones being hard, bony structures, then soft tissue is your nerves, your spinal cord, your muscles, your ligaments, those things that are soft tissues. And certainly, damage to the brain or damage to the spinal cord is extremely dangerous. It's one of the most dangerous injuries you can sustain. So soft tissue injuries, contrary to what insurance companies want to foist down your throat, oh, they just have soft tissue injuries. Christopher Reeves, the poor gentleman that got hurt in that horse riding accident that was paralyzed because he sustained a soft tissue injury. And to think about it, bones generally heal within 6 weeks in a normal, healthy individual. Normally soft tissue injuries heal in 120 days. That's around 4 months, and that again is in a young, healthy individual. If you have diabetes, for example, it can slow the healing rate down. If you're an older individual or you have poor nutrition, again, that can slow the healing rate down. And it's not unusual for people to sustain soft tissue injuries, partial tears of ligaments and tendons, spasms of the paraspinal muscles, the muscles that are around the spine. They can go into spasm, they become very tender. They can lock that segment down where it's not moving as it should, so you get buildup of fluid in the space around the nerve. That's certainly not an all-encompassing explanation of some of the injuries you can have in car wrecks. Of course you can have fractures. You can have lots of different kinds of injuries, but I wanted to open the discussion with that. So with that, I'll close this discussion for the day about soft tissue injuries from car wrecks. Again, I'm Dr. John Raymond Baker, Baker Chiropractic of Longview. Our number is 903, I'll get it right, 903-953, 903-753-5400. I had to put some humor in there. Okay, 903-753-5400. And we're open from 9 a.m. till 6 p.m. We're closed from 1 to 3. And that's 5 days a week, Monday through Friday. God bless you. Thank you for watching this video. And I hope you don't get in a car wreck and need these kinds of bits of information. But if you do, we're here for you. Thanks. Bye-bye.